A pterygium, plural pterygia, is defined as a triangular fibrovascular subepithelial ingrowth of degenerative bulbar conjunctival tissue over the limbus onto the cornea. Symptoms: irritation, foreign body sensation, dryness, redness, decreased vision. Signs: position, almost always centered at the 3 or 9 o'clock. Paralimbal position. Wing-shaped fold of fibrovascular tissue arising from the interpalpebral conjunctiva and extending onto the cornea. Highly vascularized and injected or may be associated with superficial punctate keratitis or DEL, thinning of the adjacent cornea secondary to drying. An iron line, Stocker line. Causes: elastitic degeneration of deep conjunctival layers resulting in fibrovascular tissue proliferation, related to sunlight exposure and chronic irritation. Differential diagnosis: conjunctival tumors, papilloma, melanoma, pseudopterygium, pannus, sclerokeratitis, conjunctival intraepithelial neoplasia, CIN, limbal dermoid. Treatment: medical. Protect eyes from sun, dust and wind, ultraviolet blocking sunglasses or goggles if appropriate. Lubrication with artificial tears 4 to 8 times per day to reduce ocular irritation. For an inflamed pterygium: mild, artificial tears QID, moderate to severe, a mild topical steroid, fluorometholone 0.1% QID, loteprednol 0.2% to 0.5% QID, a nonsteroidal anti-inflammatory drop, ketorolac 0.4% to 0.5%, or a topical antihistamine, mast cell stabilizer, bepotastin, ketotifen, olopatadine, may be used to decrease symptoms. If adelin is present, then apply artificial tear ointment Q2H. Surgical. Simple excision, bare sclera technique. The pterygium is excised from the cornea and conjunctiva leaving bare sclera. Excision with conjunctival stem cell graft or amniotic membrane graft. Adjunctive treatment with mitomycin C or beta irradiation can be used in place of patching techniques. Peripheral lamellar keratoplasty may be required for deep lesions.
Thank you.